It's May 16th. I'm Corey with the story, and this is Global News Today, your AI-powered world briefing. We are looking at a fresh Ebola outbreak in the Democratic Republic of Congo. Health officials have confirmed 246 suspected cases, and unfortunately, 65 people have already lost their lives. This is a serious situation that demands our attention, especially given how quickly these viruses can move through a community. To understand the scope, we have to look at the history. Ebola first hit the radar 50 years ago, and since then, it has primarily affected sub-Saharan Africa. The virus usually jumps from animals like fruit bats or primates to humans, then spreads through direct contact with infected bodily fluids. It is a brutal illness that starts with flu-like symptoms before escalating into something much more dangerous. The impact of these outbreaks is always heavy. We have seen fatality rates swing anywhere from 25% to 90% depending on the specific strain and how fast medical teams can intervene. While we have made massive strides in medicine, including approved vaccines for the most common strain, the fear and the logistical challenge of containing a virus in remote areas remain constant hurdles for global health workers. Looking back at the last decade, we saw the largest outbreak in history across West Africa, which resulted in over 11,000 deaths. More recently, Uganda managed to curb a significant outbreak by focusing heavily on community education and clearing up misinformation. That strategy is the blueprint for how we handle these crises today, because stopping the spread is just as much about public trust as it is about clinical care. Right now, the focus is squarely on the Ituri province in Congo, which sits right on the border with Uganda. Authorities are working to track the spread and provide care, but the situation remains fluid. We will be keeping a close watch on how the containment efforts hold up over the coming weeks as the medical community works to prevent this from becoming another major regional emergency.